because heat, as we know, is one of those things that can kill older people.
Mm.
And it's just for the recording purposes here, Gary is in England, and just saying that it's very hot there at the moment, and of course there is no air conditioning, and it's quite interesting how agitated people can get. The anger can rise, and this would have a knock-on effect for somebody living with dementia and the person and the care partner. It's like it's just all those things. Temperature, we know for women when you're going through the menopause is a nightmare. You have your own personal summers all the time anyway. So let alone if there's heat issues, and people can get angry, raise blood pressure. There's all sorts of things like that. I think bodily temperature is actually quite a big factor
Mhm.
for people. So you're saying, Gary, that they're going to get rid of boilers and things in
Oh,
it?
yeah, longer term, we're trying to go very green in the UK, or so they keep saying. I mean, they were talking about banning new petrol and diesel cars from the end of this decade, so that you can only buy hydrogen or electric cars, which is also crazy because they're complaining at the moment about changing pricing on the electricity grid because there's more down south demand than they can actually handle. So I mean, if they're going to get everybody to have an electric car rather than a petrol or diesel car, how's that going to work? And then now also trying to do away with gas boilers. They haven't put a date on that yet, but they want to do away with gas boilers and have people to have heat pumps instead, which means you've got to have new radiators because it won't work with the ones you've got currently, and heat pumps fitted. I mean, they're saying for the average household, you're looking at probably 10, 12,000 pound to have it done. And so, where do they think everybody's going to get the money for all that?
Exactly. I mean, houses are old,
Yeah,
our old house in when we lived, it was
mm.
1873.
Yeah, and
So
that's the other thing with air pumps is that the houses need to be very good with insulation.
no, no,
Yeah,
it's like no, oh my goodness. So yeah, crazy. I mean, it's just the new builds that will be able to have it because they've got
yeah.
solar power. They put solar things on them and what have you.
Yeah, some of them have. They're doing that, but
Yeah,
they have to have
it's
lots of insulation and stuff, and they're making them smaller and smaller anyway. So
but that kind of thing alone, can you imagine the stress for people
yeah,
trying to figure that out when they're also trying to just navigate life
mm,
with everything else, and it's just one more thing that is needing to change. It makes it make life very
hmm,
scary for people. And that's why so many people just want to hide and hibernate and not go out and live,
hmm,
because the world, suddenly starts to become smaller and more scarier, and all these things. So yeah, it's
yeah. My
that's not
biggest change bugbear at the moment is per my computer, because of course the Windows 10 is stopped being supported in October, or you've got to pay for it for another year. Because they want everybody to go to Windows 11, but you have to have newer computers to go to Windows 11 because it has to have a special chip in it, which mine hasn't got. And I mean, to replace mine with a like for like, it's probably about £2,000, and it does everything I want it to do. So why do
Yeah.
I need to change it?
All fixed in. Yeah.
yeah,
But of
it's
course,
it's
the problem is if you don't change it, I mean, you can pay for support, I think, for another year. But then, of course, if you don't change it after that, there's no more support, which means you're then at risk of getting it hacked and stuff because
right,
hackers will look for holes in the operating system because there
right.
won't be any patches anymore.
So again, people who are used to something and things are changing. And change is so often the thing that can be so scary for people as they become older. It's like with the highways, the roads start to change, more people come in. Suddenly there was traffic lights there and now there isn't. And it's quite interesting where there's a whole load of trees that have just been taken down and the landscape looks different. So it's like I came up and I went, am I in the right place? Have I driven? It was like, because I'd come back from Arizona and it was like things had changed. And can you imagine if you have a neurocognitive disorder and you come back and or wherever you've been and landscapes have changed, there's new houses up, you know, the thing that you used to have, I don't know what you post offices, people used to, or the pub, people used to say, where do you live? Oh, turn right at such and such a pub. That, you know, the post office is there, turn left, you know, and people would have their places, their landmarks, so that they would know where they're going. When those change, it's very, very confusing. Very confusing. And I know we might well have little, you know, on Google, you know, go this way, go that way. But it's like, if you've got living with dementia, you don't know how to necessarily use that.
Well,
So you
how
can,
accurate it is anyway.
you can understand, and that's where we have to be at people's, we have to get into their shoes. We really have to understand that this change thing is big, and what can we do to make it easier for them? Gary says, make a new pub. Go left at that one instead.
Yeah.
But it's true, isn't it? And you can understand this, how scary it can be for people, and even you know, at any age, change is scary. Any age. So it's quite interesting. Is it changing there where you are, Carrie-Anne?
What do you mean changing?
Like the landscape?
No, we're pretty protected because I kind of live in the forest. I mean, I'm in a community, but we've got forest all around us. I have trees all over. And the biggest concern, of course, is fires. Yeah.
Okay, there you go.
Yeah.
So that would be.
So we're part of the largest ponderosa pine forest in the world.
Oh,
So,
how nice.
yeah. Yeah, so that does. But, you know, sometimes trees die just around, you know, the neighborhood and stuff like that. And have to cut them down. And that's always a big change to see, oh my gosh, the tree's gone. We had a couple of trees that somehow interfered with the power lines, and they came and they said we had to cut them down. And so that was like, oh my gosh, you know, because we love our trees.
Yeah.
And yeah, so
And people can
those
get
were
very, very
healthy. Those were healthy trees.
Yeah.
So it was kind of, you know.
It is, and people they can attach memories to them. Maybe they've carved their names into them, maybe or whatever that, or maybe they, you know, leant against them and, you know, had mad passionate love against them, or whatever it was. You know, that those are memories, and sometimes those are taken away. It's so the whole thing of change is one for us to get curious with, for people, because that in itself can make people very flustered and unhappy, can cause all sorts of, and make people feel weird, that they've lost their identity somehow again, because there's so much change. It's like, who am I? What am I? Well,
Yeah.
you know, I knew who I used to be. Now I've got this confusion as well. Now I'm lost. And that lost feeling, we can only imagine is pretty horrendous for people, and can cause other behaviors.
Yeah.
Anger, especially, or depression, which is they just don't want to get out of bed, they give up, which is very true. People can give up. There's more and more change all the time at the moment, and of course, right now we're videoing this, and we've just had massive change in the world, because there's been, none of us know exactly if things will escalate or with Iran, or if it's just going to go and that's it, stop, and things will get better. Because I'm hoping that will be the case. But again, with people who we may be seeing right now, if there's any mention of war again, they could be getting scared. They could be reminded of the Vietnam War. I don't know if any of you have you watched the videos yet of Chester.
Nope.
They're in the group. When we did because he's dying, and he's an MD. He's a hospice doctor. He knows too much about his condition. He's dying. He also said that he was a Vietnam veteran, and and he goes, and it was pretty grim. He goes, when he came back, there was no yay. They were baby killers. That was how they were perceived in when they came back, and that's why, sadly, so many people have done the alcoholic route and things like that, from Vietnam. You may have heard stories of that, Carrie-Anne.
Well, yeah, I kind of lived through that time. Actually, my father was in the service, and he retired just as it was starting, because he said he didn't want to go to war again, So, though right now, there's a huge amount of suicide with soldiers that are overseas, even though I think we really kind of, in our country anyway, kind of revere them as they come back, and thank them for their service and that type of thing. A friend of mine that's in a networking group with me has a nonprofit called Lower 22, I think is what it is.
My
And
husband,
they're raising money. They're raising money for the soldiers that have suicide. He said, I forget, I mean, the
22 a day, it's called.
deaths a day are incredible through suicide from soldiers returning.
Yeah.
Yeah.
It's hideous. Hideous.
Well, I think part of it, like in other countries, I remember I was in a logic class in college once, and there was, I don't know, there was an Iranian there. I choose to remember if he was from Iran or Iraq, but he was there, and he just hated the other one. I mean, his hatred was palpable. I mean, you couldn't, and the teacher was trying to point out logically that people are people. It didn't matter if they were, Iranian or Iraqi or black or white or whatever they were people, and they should be valued for the person that they are.
Yeah.
Boy, he could not accept that teaching at all. I mean, he was so angry because he'd lived in war his whole life. So with them, war is just part of life,
It's their
because
model of the world.
they've done that all over. But for an American, a young man in America, we just had a young man that worked for my husband that just left for the service. They've never experienced that. And all of a sudden, they're in war. they're in a, and so they've not experienced so much of that. I mean, there are divisions in how people believe in things, but actually in a war with, someone else.
Yeah.
And be violent toward them in any way. So it's very difficult.
Yeah. And then you have to come home and be all light and fluffy.
Right. And yeah, a lot of them can't do that.
Yeah.
They've had injuries they've had.
It's like a decompression needs to happen. And that's why
Right.
so many of them just they don't talk about it. Or again, they will drink and numb. And if they have a pain from something, they'll take something to numb it. And then, of course, sadly, or maybe emotionally eat. And then, of course, sadly, they're more open to, the vascular dementia, hypertension,
Sure.
and diabetes, all these sorts of things, which can, as I say, lead on to a dementia. So it's because it's the environment, and funny enough, that's where I was wanting to lead on to today, was environment for just to finish up this whole hypertension bit that we've been learning, because vascular dementia is the one that we can help people prevent or at least reduce the likelihood. So if they've, say, got vascular dementia, then right, okay, we know we have that, but what else can we do now to make you healthier? What can we change? We've already discussed salt, all the salts. We've discussed alcohol. We've discussed exercise. We've discussed anger. We've discussed perfectionism. We've, so many different of the X factor, if you like, things that doctors wouldn't look at, which is all around the environment. And so it's it's worry, it's and then it's also interesting. There's the whole thing of, oh well, my family had high blood pressure, or my family had stroke, so I will. People just naturally, they think it's
what a message to send to our body.
Yeah. And so probably sometimes it will, if that's the story you tell yourself. And you know what? At the end of the day, maybe it is. Sometimes, it's maybe it is in the DNA, because they say that they're, you can have the Alzheimer's test, and if you're APO4 or something like that is more, I've probably got the numbers wrong, if you're more prone to it, to getting Alzheimer's. So it's if your parents had it. So any questions on anything, or anything anybody wants to add before we look into more things that I've got written down here? There's some secondary hypertension things. I've not heard of some of these before, but I've heard of some of them. So I'm just going to throw it out there and let's have a little discussion of them. Secondary hypertension. Okay, again, remembering that all of this stuff can lead to vascular dementia. All right. So there's the obstructive sleep apnea. Causes release of the stress hormone, adrenaline, which increases heart rate and output flow and constricts blood vessels resistance. So I hear of sleep apnea a lot. I expect you both do too. So we know that one. Now, I don't know that I've heard of this one. Aldosteronism. Oh, I have. I've heard of hyperolder. Why do they have to have such difficult names? Gary, you should be reading these. Hyperaldosteronism.
Is it elder or alder with an A or an E?
E.
Elder.
Hyper and then at Aldo. I think I might have taken some pictures of these for you. So just don't worry about it. Excessive aldosterone, stress hormone again, from the adrenal glands causes sodium retention, increasing the blood flow volume. Renovascular hypertension, renal artery stenosis, obstruction of renal arteries that damages the kidney, increases renin output, which affects blood flow. Primal renal disease, kidney disease affects blood flow. I mean, a lot of those would probably end up, you'd get cancer. More likely from many of those. Would you? Kidney issues?
No, I wouldn't have said so.
No, it's a completely different thing.
Yeah. Kidney disease is different. It's obviously blood flow from it, or diseased and whatever. It's. I mean, you can get cancer in the kidneys, but it's more likely. Cancer in the kidneys is more likely if it's sort of metastasized from somewhere else.
Okay, so it's like popped off from somewhere else. Okay.
I mean, you can get kidney cancer, but it's not one of the common ones.
No, I don't think I've ever heard. It's always liver or pancreatic. I don't think I've come across
I mean,
cancer.
pancreatic sort of quite a nasty one because that's very quick, and it's difficult to know that it's there until generally it's far too late and fairly quick. I mean, you know, you've got the standard one, sort of breast, well, skin, so the main one. Then you've got your breast is your standard one, and your sort of prostate and stuff like that, and then
lung
when it moves. I mean, liver. Lungs, is a major one, but quite often a lot of the lung stuff again is metastasized from something else.
Okay, usually from the breast, I think, isn't it?
Yeah, breast will quite often go to the lungs or the brain, and sometimes the liver.
Yeah, it's so we've got Cushing's syndrome, excessive cortisol, another stress hormone from adrenal glands, enhances adrenaline's ability to constrict blood vessels. So it looks as though it's all around, which is why, of course, I suppose you would have the ischemic attacks, because it's like, looks as though there's like constriction of the blood vessels so that you're not getting the blood to the brain. So hence you're having these little brain ischemic attacks. Narrowing of the aorta causes knock-on effect to kidney, release of renin, which generates oh my gosh, it's really tiny writing, vasoconstrictors to constrict blood vessels. Endocrine, hormone disorders, hypothyroidism and hypothyroidism. Oh my God.
My cat's got that, hypothyroidism.
Is he?
Yes, yeah.
And then there's another one, pheochromatoma. No, but it's non-cancerous tumor. And oh my gosh, like I say, Gary, I should have sent this to you. I can't say these names. Anyway, and then gestational preeclampsia. Okay, so that's interesting. Isn't that interesting that the preeclampsia, you could get the high blood pressure, and actually I think I have known women get strokes when they've been pregnant. Not awful. And again, then they are potentially, they have to be careful because they, you know, could get the dementia from it. And this is, so it's all about the we've got to look after our blood pressure. You know, it's that blood pressure. So other diagnoses, again, malignant, a sudden rise to resistant, I don't know, isolated. Oh, it's all the diastolic things. Okay, so let me see. Yeah, so we have to focus on those X factors and help people, as we've already said, with those things around their attitudes, and oh, this is an interesting one. Having attitudes, check beliefs. Does anybody else you know, I mean, I don't think I'd ever say to anybody, why do you think you have dementia? But why do you think you've got hypertension? What do you believe keeps your blood pressure high? Is there any upside to having it? What would life be like if you didn't have it anymore? Can you imagine yourself getting better? And that's, you know, as I mean, I don't think I would say that to anybody living with dementia. But it might be interesting to say, what can you do to you know, to encourage your day-to-day life in getting better? What can we do and bring them outside? You know, it's like, and just so getting them on side with us so that we have that plan and get them a little bit more excited about life again, that there is stuff that they can do. And that's why when we start giving them little bits to do, like the exercise, 20 minutes walk, what can we, you know, about just different things they could look at to eat, looking at the environment, because people, I think, like to have things to do, and they like to have a plan. What do you think?
Yeah, yeah. I mean, yeah, I could have less,
Right.
lose weight, exercise more, and drink less, but I don't plan on doing any of them.
I know, and it's interesting because what are you waiting for, Gary?
What am I waiting for? Well, nothing
Mm.
particular, but I mean, if I did all that, I'd have a much more boring lifestyle.
Okay. So Gary's living in his moment, yeah?
Yeah.
And that's it. And that's Gary's choice, you know, and it has to be that way. So if we have somebody, and this is and this is really important, actually. I'm glad you said that, Gary, because if you are with somebody, so say the caregivers the care partner has brought you in, can you help my person? Well, I'm not going to stop smoking. I'm not going to stop drinking Coke. I like it. I'm not going to stop doing this. Okay. And that's their right. Because who are we to tell them to stop?
Yeah.
You know?
Person is in charge of their own destiny.
Yeah. They're not in prison.
Whatever.
Yeah.
And a lot of people.
And also it's perhaps taking away some of the happiness and enjoyment of life. I mean, it's something I've read somewhere. I mean, it was a joke thing, but it's saying, you know, giving up, was it giving up soft drinks, coffee, and alcohol, and drinking nothing but green tea, will not make you live longer. It will just seem like it.
That's a great thing too. And someone said to me the other day that their motto was eat, drink, and die.
There you go.
That's it.
Yeah. Yeah.
So I said, okay.
And you know what? I mean, that's why we have to be like really careful. We're not coming in there as the Gestapo saying da 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 da. So it's, what do they want? What do they want to change? Okay. Yes, we know they're living, and this is, there are things that you can do so that you live longer in those first few stages of dementia, you know, before you go down the road of it. There are some of the dementias that will knock people out like that. Just like, as Gary has said, there are some of the cancers that will get you. Pancreatic is one. It will just get you within 6 months, probably. Okay. I lost a friend recently. She was September, she was gone just literally day after her 60th birthday, gone. It's so yeah, it'll get you. There are some of the dementias like that too. There are some that you could live with them for 10 years and it will be, you'll die of something else way before that, before you're even in a home. Now, the thing is, it has to be that a shared, agreed action plan. That's why when somebody first gets their diagnoses, what can we do? What can they change? What do they want to change? We are only making suggestions. So if you have somebody who says, there's no way I'm giving up my Mountain Dew, even though the soda is sugar is an absolute nightmare for the brain.
Yeah.
Okay, it is. And I like loads of salt all over this. Yeah, I've had vascular dementia. I've got vascular and Alzheimer's mixed. No, and you know what? Then there's only so much you can do. You've given the information.
You know, I would kind of, if it were a salt situation, lead them toward unrefined salt, Celtic sea salt, and
Yeah,
Himalayan Redmond salts. My doctor recommends Celtic sea salt for blood pressure.
Yeah,
for high
there you
blood
go,
pressure.
because it's got the volcanic stuff in it.
Right. And he said it brings it down all the time.
Yeah.
Yeah.
So there are things that we can just go, oh, but you could do this. You could do that.
Right.
So yeah, what would that be like? Or how about, yeah, no, I eat a great big bag of chips every night. Which, I know Gary, you'll know that those are a big bag of crisps. Okay. Okay. What would it be like if over time we just had, got it down a bit, and you had a bowl so that you had to get up and go, and then that means you're getting up and moving your body, and that's good for you. What could you?
That's really key.
Could you do that?
Mm-hmm.
Yes. It's like, and then generally, people just will have enough and sit, and rather than sitting there, because that could just be habit or just not knowing, or it's just laziness, basically, of sitting there with a whole bag of chips, popcorn, a whole box of Oreos, whatever it is, I'll just get myself, instead of having to keep getting back up and down. It's just like, again, oh yes, well, okay, great, you like your beer or your wine or whatever. What would it be like to have a glass of water in between? Can you do this? So that's what we're there for, the shared agreed action plan. We're not there as to tell people, no, you've got to do this.
Right.
That's not going to work, and you'll never be going back. Because actually it's about giving them tips and tricks to help them, because it's their life. And as Gary, it's like my uncle, actually, he died, I don't know if I mentioned this, and he died, he had cancer. Well, I thought he was going to die 10 years ago. He got about another 9 or 10 years, another sort of like 9 great grandchildren, and he smoked his pipe, because that's what he liked to do. And do you know what? Good for him.
Enjoyed life.
And he enjoyed life. Yeah, he loved it. It was.
We hear about people all the time that live to 100, that smoke and drink and do whatever they want to do. And, I think there's something to that. And maybe just the idea of a joy in life, whatever that joy is, that does a lot for us.
Joy de vivre. There you go. The joy of life. And it's like, as Gary has said, well, do you know what? Oh, I enjoy going down to the pub. I enjoy this. That's my quality of life. I enjoy that. I enjoy that. And so therefore I'm a happy boy. And therefore, because I'm happy, I'll probably live longer, just simply because you're happy.
Yeah. Yeah.
And there is a lot to be said for that. So however, it's the whole thing of the dementia bit. So let's add it in what we can. Yeah. Blueberries along maybe with that other snack, this along with dark chocolate, along with, just swapping that for instead of white chocolate, just certain things. What could you do? What could you do? What would you do? And that's where we come in. Because then, of course, the whole thing is that if there's a few lifestyle changes here and there, and it's a gradual thing, then that's also looking after the caregiver. Because imagine being the care partner as well. Say you might have high blood pressure. You can't afford that. And they're the care partner. They haven't got time to have a stroke. So they have to look after themselves as well. So it's just about us educating as much, but in a nice, gentle way, instead of being you will do this. I don't think any of us would do that anyway, because we're not like that. Yeah, always, I think, finding the humor in things. Every single time I'm at anybody's house, we bring in the laughter.
Mhm.
So the other day, and I don't know if I've said this already, but I was at my clients' houses, and they said, well, because he's falling a lot, and so they have to have these like rolly, pushy things, and he didn't like it, and so she got one as well. So both doing them. I thought it was
They both
great.
have walkers.
Walkers, yeah.
Walkers.
And I'm like going, oh no, it's a real embuggerance, isn't it? Well, they thought that was hilarious. All right, the word embuggerance.
Mhm.
And then he sat there, I have to look this word up. Is it made up? And I said, it's not. I said, it's a real word. It's actually from the forces. My dad used to use it. And it's like a word that you would use for something that's annoying. It's an embuggerance. And so I said, right, well, you're going to be taking your embuggerances for walks then. So now they say to each other, let's take our embuggerances for a walk. Now they're laughing.
Mhm.
It's just different. It's just a different, it's just a different change, isn't it? So it's reframed it. They're laughing when they're then they've got to go for a walk, you know, because they're taking their embuggerances for walks. So whatever you can, come up with something, even name, so personify the thing they have to do that they don't like doing,
Mhm.
and then it changes it, just like for children. Yeah, it's just make it more fun, and it just changes it out. I don't know if Gary, have you got any patients at the moment who have got dementia and cancer?
No.
Interesting, isn't it? That they, yeah. Do you
Yeah,
come
no, it's very rare that I get dementia patients or anybody that's got dementia.
It will happen though, because it's
Mhm.
there's somebody's being diagnosed every 3 seconds.
Yeah. I get more and more strange things, but
What strange things do you get?
well, it's strange. I got a really strange one yesterday. Well, it's a sports performance one, but I keep getting sports performances for sports I've not heard of. That's the thing. I got somebody who's it's going to be an interesting one. I think it's going to be teaching herself hypnosis. Um, is the idea, but she's in the English team or British team to do it. I didn't know there was such a thing. Have you ever come across a thing called ultra yard running?
No.
No, neither had I. It's a really extreme sport, apparently. I had to look it up, and I found somebody that knew about it, who's put me in touch with somebody. And it sounds another one of these sports that's really silly. Basically, what they call ultra yard running is that you do what they call run a yard or run the yard, but the yard is just over 4 miles. I think it's 4 miles and about 180 yards or something. I don't know why it's that. But the idea behind it, and I mean, it makes marathons look silly, because what you have to do is you run yards, obviously. So a yard being this just over 4 miles, but you have to run it. You're disqualified if you don't, but you have to start to run the yard on the hour every hour, and the winner is the last person that's still running the yard. So I mean, the person I'm doing, her record is 50 in a row. So that's 50.
Oh my
So
goodness,
that's
God bless
so
her.
that's 200
Wow.
miles over 50 hours. And
Yeah,
because it's on the hour every
100.
hour, what she wants is she says she paces herself and she does it on average in 53 minutes. So she wants me to teach her, if I can, with hypnosis, to allow her to sleep for 7 minutes between each yard that she's doing because she wants to push beyond 50 hours of it.
Wow.
So he's got my mouth open. That must be an American
Wow.
sport because it's the yard.
Yeah, very possibly. I believe it.
Or started there because they still
But
have yards here.
yeah, but that's what she wants me to do. She said, "Oh, can you hypnotize me or teach me so that I can sleep for 7 minutes
Yeah,
and
you
feel
can and do
and feel
time
invigorated."
distortion.
Yeah, and feel invigorated between each yard because
Yeah.
literally she says she'll do a yard in 53 minutes, then has 7 minute rest, then has to do another yard. And as I said, she said she's pushed. She says the second best in the UK at the moment, but she can do 50, so that's 50 hours at
Yeah.
4 miles an hour.
So
it's
when I
200 miles in
Wow.
50 hours.
yeah, it's so you give her a trigger word. You'll
Yeah,
probably know this already. I
Almost
don't even
like
know what to
200
do.
miles.
Yeah.
yeah, over
Um,
50 hours without a break. Well,
and
7
where
minutes
does she
every hour.
eat and pee and poo and
I don't know. I've not spoken to her. I've just had this email from her saying, "Oh, if you come across this, this is what I want to do. Do you think you can help me?" So, I've done some investigation. Spoke to somebody who's put me in touch with somebody that does
how
it.
many days would that be that she's on
Well,
the continual?
well, it's just over 2 days, isn't it? 2 days and
2
nights.
days. Yeah.
48
Yeah.
hours is 24 hours a day, so it's just over 2 days.
Yeah.
My chiropractor's son does the 200-mile thing. It's
Yeah.
brutal.
Right.
It's brutal.
Well,
But
the idea is to go
it's a
beyond that.
marathon. It's not
Yeah.
it's
But
not
the
this.
idea
This
of
is
this is to
really
go
interesting.
beyond it because the winner is the last person that's still capable of doing the
Another
job.
yard.
Yeah.
Another
It
yard.
hasn't fallen over yet.
Yeah,
Well, it's
basically.
literally the last one standing, isn't it?
It
Right.
is. Yeah, it
Oh
is.
my
But
gosh.
I mean, you get disqualified if you don't finish it or you're not ready to start on the hour.
And you have to
Wow.
be, and you have to do the full 4 miles.
Yeah.
Wow.
So I suppose she must drink while she's running then, so that she gets
Yeah.
hydrated.
Yeah.
Probably. So if you do a 9, I mean, it depends how fast she is, but I mean, it's like, oh my
And you
gosh.
need to pace yourself is one of the things because you're doing a lot. She says that she
Yeah.
paces herself, so she'll do. She says that she averages the 4 miles in 53 minutes. Is her pace.
Okay, so that's so, and then she'll probably eat while she's doing it as well. Then
I
maybe,
think you can eat
or
while
has
you're doing it.
those
Yeah, I'm
loads
guessing
of
so.
energy
Yeah.
drinks.
Yeah, I'm guessing
But
so.
yeah,
And you got to consider shoes and
Yeah.
the
But
weather
thing
and
that
all
seems to
kinds
be
of
the
things.
main thing that seems to be holding back is basically fatigue. So
yeah,
it's
yeah. I can
obviously
imagine be the
Sure.
fatigue
not having sleep for 50 hours
and still
Right.
running.
and running 200 miles in that time.
Right.
Mm.
Mm.
Well, do you know what? It's a sort of thing that people used to do when they were the refugees
Yeah.
and with babies on their backs and fear of their life, and they would do that over the mountains. They wouldn't necessarily be running, but they would be walking. There'll be plenty of, and they had to keep going.
A lot of inspiration to keep going.
But there's what I do sometimes, if I haven't slept very well, I have this, I'll give myself another 5 minutes, and then I say pink watch, and that gives me 1 minute equals 10 minutes, so I get an extra 50 minutes. What you could do with her, have the trigger word and then say 1 minute equals an hour. So she then has 7 hours sleep
Yeah.
in between.
That's a good idea. Claudia, I'm going to have to be leaving here.
Oh, I
in
didn't
just
finish.
a
Sorry, we got
minute, yeah.
sidetracked.
No, that's okay. I just have to leave early.
Okay,
Another
but
minute.
that's fine. But that's the sort of thing that we can do again for our caregivers. Actually, that time for sleep, that rest, which
Yeah.
it's very useful that you said that. If somebody is not getting enough rest, then we can give them a trigger word, and you can do time distortion with them, so that they can get enough rest. Okay.
Yeah.
That's why I carried on talking about that. Give them a trigger word for the care partner, and that extra 1 minute can be like 10 minutes, or so that they're just getting a bit of rest by in between. you know, and have a rest, just like with a baby. When a baby's sleeping, you have, you know, to tell the mum, sleep, forget the house, do it with, you know, it's like rest when the baby's sleeping. You know, it's like, but of course mothers never do.
I'm going to have to say goodbye.
Bye. See you next week.
I'll see you next week. Yeah.
Bye, Carrie Ann. Bye-bye. 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 Yeah. Yeah. So that is what we can do with our caregivers. And again, if our person living with dementia isn't sleeping so well. But that's the whole idea of us doing the hypnosis.
Yeah.
Because when we're doing that within hypnosis, they are actually getting that, the eyes are going left, right, they're getting the acetylcholine, which is giving them their, you know, which is good for the brain synapses. So that's the whole beauty about that. I'm not sure that anybody's going to need all those big names, actually, that I just said. It's because we probably wouldn't come across it.
I do get occasionally now clients sort of, you know, looking up whatever the main word is, or whatever the doctor's told them, you know, and somebody will say, oh, have you ever dealt with such and such, or have you heard of such and such? And I'm thinking, I need to look that up, because, and then,
okay,
the bog standard this, or, you know, that.
I know there's so many. So would it be useful?
Yeah.
Just to have some of those, it's really tiny writing. But I'll, you know, it's just extra little bits and pieces that you can have, because you're such in the medical field, Gary. So you probably do, you know. But again, the whole blood pressure. Do you take people's blood pressure at all? No. I have done
medical
I have done when they're coming to me for hypertension, because I'm on the hypertension website to help people with that. It's just that, like I say, it is one of the ones that we can help people with if they're saying they've got vascular dementia. If they've got vascular dementia, then they've probably still got high blood pressure. So what can we do to help them? And so we get curious, and it all comes down to lifestyle, so much of it. You know, but as I say, again, a lot of perfectionism, arguing, getting angry, all those things. And we can help people from past issues, because we have the ability to. And I think that's the important bit, to be able to let them go. The anxiety thing, you know, we all, I'm sure, what I might do in one of the sessions actually is just add in, while I'm in Vegas and I'm not able to come on here, I'll add in, I'll put up, yeah, because you'll be there with me as well. I'll put up some audios, like Magic Cloud and things like that. The Magic Cloud takes it away. They're just really nice ones that we can do for our clients. Healing Globe, you know, there's loads of things that we can do for our clients that are just very, you know, and it is relaxation. Relaxotherapy has a place. It doesn't always have to be boom, boom, and like you're out. You know, in my opinion, I'm afraid relaxotherapy has a big place for people. That's all they want to do sometimes, is just close their eyes and you talk to them and they feel amazing. There's nothing wrong with it, but there's so much of this kind of, yeah, you don't have to do that, oh, you know, it's all these big egos. I think. I don't know, maybe some of them.
I always explain to my general clients that I say, well, hypnosis, relaxation isn't required for hypnotherapy. It's a myth. So I said, you don't need it at all. But I said, but people associate it with hypnotherapy and it's nice and pleasant. So I normally incorporate it because it's nice.
Yeah. And it is nice. I mean, it seriously is nice. So this is one thing that I said to a lot of people, you know, it's like, that's what people feel like. And when you do the relaxation bit, then they go clear-minded. Because when you're relaxed, you're calm. When you're calm, you're clear-minded. And when you're clear-minded, you can handle any situation that comes your way. That's it. It's very simple. And so, yeah, I use that a lot. So that's so I'm going to leave that there, that actually there are things we can do. I'm just going to turn the recording off. And there we go.